Hello, this is Dr. Ravikanth. I am interventional cardiologist, Yashoda Hospital, Somajiguda. Today we are talking about the new variant of COVID. How does it affect heart, whether it affects our heart or not. So I want to just impress on you, anything can happen with a new virus. Any new virus, or for that matter, any mutant which comes in from whether it is an old established virus also, leave about COVID. Any virus which gets mutated, that means a new avatar. If it takes a new avatar, then it will decide what would happen only by which is known to the virus itself. But as a doctor, how do you know it? So it is only by previous experience you can tell what could happen. So as of now, the way it is going on, the virulence of the virus has been coming down. If you look at the first wave, second wave, and then third wave, which is Omicron wave is negligible when you look at mortality. So if you look at the hospital admissions or anything, they have come down drastically when it is Omicron. So after the Omicron, now if you look at hospital statistics anywhere, like I am working with Yashoda Hospital, Somajiguda, and when I look at the hospital occupancy, hardly we find any COVID case now. So the COVID, it doesn't mean that COVID is not there in the atmosphere, weather, or in people. COVID is living with us. It has made a better living with people, and we are getting sore throat, body aches, some kind of fever, malaise, weakness. All this are happening to a lot of people now, which is most likely COVID, and which is a less virulent variant, and the mortality is extremely less than 1 in 1,000. Whereas the second wave, the mortality was about 2 to 3 per 100, and admissions were about 10 to 15 per 100 people were getting admitted, and everyone is getting affected in second wave. That's why the hospitals were full. There was an inflow of lot of patients, and there was a chaotic thing, and it was real mess. So now the virulence has come down. But what is next? So there is a news that there is an outbreak in COVID in China, the COVID outbreak, which is a bit alarming. But we don't know really about deaths. They are not coming out with how many deaths are happening. But the virulence is, they say it is amounting to hospital admissions. So whatever it is, always any viral infection would be like a flu. It would be like malaise, lethargy, weakness, body ache, sore throat, and cough, all this. And eventually some people get affected with the lung, which has been happened in second and first waves in rampantly, and third wave extremely less. So we have to get prepared to face any kind of situation again. But you understand, a lot of people are vaccinated, a lot of people have tasted the virus already. So we would have immunity, I guess, we would have an immunity which would really help us to throw out this virus. And be brave, be strong, especially psychologically. Don't get panic what happens next. If at all, if it is virulent, the only mantra would be mask. A lot of people keep sanitizing, not wearing mask, which is not useless, because the virus would always move through nose and mouth. So try wearing a mask in appropriate situation. It is not like you are alone in radius of 3 kilometers and you are wearing mask, which was useless. So the virus travels from one mouth and one nose to other nose through air. So if you have someone in your radius, say 1 to 2 meters in radius or 3 meters in radius, and who is probable culprit, who is having this virus, so you have a tendency to pick it up. So try wearing a mask in that situation, and it should be snugly fit, covering your nose and mouth. So this is the only mantra which would help you in postponing the infection. And especially the postponing the infection is very important, because initial things, we don't know how the virus behaves. So if you try to avoid the first infection, even later on there would be a remedy, there would be understanding about the virus, and you will be benefited. Not try, the mantra would be wearing the mask. Okay, so don't fear about what is going to happen with the new virus variant. But I can tell you, the new virus variant is a Omicron sub group, which is I think BF7. So some kind of variable. It doesn't matter what is BF7, BF4, BF3. That is all nonsense. What you should know is the virus had made a change to make itself again prominent and actually fighting with the people. And it is actually fighting with the people to live with it, live with the people, but unfortunately the mutant variants would always try harming us. If it doesn't harm like any other influenza, then we would be happy. You get a cold and you will get recovered in 3 days. That would be wonderful. So whatever, having said that, if it is virulent, the only mantra would again be keeping social distance, especially snugly fit mask covering your nose and mouth properly in appropriate times. Thank you.